This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Hey EMM, we are excited to announce that we are now accepting applications for our second annual Diversity and Inclusion Award. The award is eligible to fourth-year med students identifying as underrepresented in medicine and are applying to EM residencies. We are extending 3 $200 awards to selected individuals following a blinded review of all applications. Applications will be accepted through the end of November, with winners being announced mid-December. Check out our website at www.emergencymedicalminute.org/EDI-award for all the details and to access the free application. Or you can click on the link in our show notes. Thank you.
So, just I wanted to do a brief medical minute on syncope and on the utility of getting the EKG in syncope, like what we're really looking for. So, there's lots of causes of it, and probably the most important part of a syncope workup is getting an EKG, and it's really important to kind of remember like why we're getting it and what we're really looking for. So there's the obvious things. You're looking for signs of ischemia or like an obvious dysrhythmia. Obviously, if the patient's in VTAC or something, then that's what the diagnosis is. But excluding those things, there's only a couple of important diagnoses that the EKG is really telling you. And the mnemonic to remember this is WOBBLER. So that's nice and easy because it kind of makes you think of someone who's about to fall over, who's about to syncopize. And so that mnemonic WOBBLER will tell you kind of what to look for on an EKG. So the W, anyone know what that might be for? Exactly, WPW. So you're looking for that classic delta wave, that slurring upslope of your QRS. Then the O is a little bit of a finicky part of the acronym, but it's an obstructed AV node. So if someone's got heart block, that's a really important diagnosis to find. The first B is for, anyone have a guess of what this might be for? Brugada, exactly, Brugada syndrome. So that's a sodium channelopathy or sodium channel blockade. You've got this kind of ST elevation or coved ST elevation or saddle kind of change with it. The second B is for a bifascicular block. So if someone's got a right bundle branch block and then they've taken out their left anterior or left posterior fascicle, then they're only conducting through one fascicle, and so they're at very high risk of having heart block. So that's a really important diagnosis to catch. The L is for LVH, and not because LVH in and of itself is a problem, but because it could be a sign of HOCM, so hypertrophic obstructive cardiomyopathy. So you look for that with associated dagger Q waves, or in an elderly patient, it could be a sign of aortic stenosis. So that's kind of what you're looking for with LVH. The E, would be a trickier one. This one is for Epsilon waves. Does anyone know what Epsilon waves are or what they're for? Epsilon waves are this positive deflection that happens right after the QRS. They're kind of similar to Osborne waves, which is I think what you're getting at with the hypothermia. But Epsilon waves are seen in this one condition called arrhythmogenic right ventricular dysplasia. It's a condition where there's this fibrous deposition in the right ventricle. It's usually in younger people, but an important diagnosis to catch. And then lastly, the R is for repolarization abnormalities. So someone with a prolonged QT or a shortened QT, either from an intrinsic disease or from electrolyte changes. So that's really what you're looking for with the EKG. So WOBBLER every time you have a patient with syncope. All right, great job. Let's have a good shift.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.